Hi everyone, this is Dr. Elliston. As you all know, basically every child has been sick multiple times all fall long, and it has led to it being difficult to get a hold of Tylenol or ibuprofen on the store shelves. There's not actually a manufacturing shortage, but the medications have been overused by the public at large, and now there's so little of it available that when people see it on the shelves, they stock up, which means that now you can no longer find it when your child gets sick. This will improve soon. But in the meantime, I wanted to provide some more information. You have two categories of medication. You have Tylenol or acetaminophen, which is the same exact medication. Tylenol is the brand name. And you have ibuprofen, Motrin, and Advil. We couldn't actually find some children's Advil to include because it's hard to find. But ibuprofen, Motrin, and Advil are the same thing as each other. Tylenol and acetaminophen are the same thing as each other. These are two different categories of medication, and the two categories are not interchangeable. One thing that's very important to keep in mind is that these are optional medications. Kids do not have to have these in almost any case. We use them primarily to help kids who feel so badly that they aren't drinking enough to stay hydrated, or that they feel so badly they can't fall asleep and get the rest they need to get better. We do not need to use them to control almost any fever. There are a few small exceptions your pediatrician can guide you through. But for the most part, fevers help the body fight off infection. The body is doing it on purpose, and the fever itself is not harmful. If anything, it is helpful. So treating just the fever is not actually our goal. That said, because it's difficult to find these medicines, we need to be creative. The infant's Motrin that comes with a syringe is the same thing as the adult ibuprofen in a tablet. I could actually take the infant's Motrin myself if I took the right amount. In pediatrics, for children, medication is always based on their weight. We will post a medication dosing guide down below that will walk you through it, but based on your child's weight, you know exactly how many milligrams of each one of these kinds of medicine to give when you need to give it. Then you just look at the version of the medicine you have and make sure you're getting the right milligrams for your child. So for example, this adult ibuprofen tablet is 200 milligrams each. That is very standard. Obviously, a 9-month-old who needs ibuprofen can't swallow this. So you could get a pill cutter or a pill crusher. And so for the pill cutter, I'm taking this 200 milligram tablet and just chopping it in half, which usually it does actually in half. So you just want to make sure it's the full half. Then you can put it into a pill crusher and take that 1/2 of the tablet, which is now 100 milligrams, and crush it to a powder. That is the same medication as 100 milligrams of the infant drops. This does not taste very good on its own as a powder, so you want to mix it with something that's more palatable, like chocolate syrup, honey if your child is over 1, applesauce, and they can take it that way. If you don't have a pill crusher, then you can get creative and use the bottom of a glass to crush it to powder, or the back of a spoon. And it accomplished the same thing. Arguably, that was actually better than the pill crusher. This is how we can get creative. News to me is that this is actually adults' acetaminophen as a liquid version. It's actually the same as the children's and infants' Tylenol. This is 33 milligrams per ml. If you do the math on the infant's acetaminophen, it's 32 milligrams per ml. That is essentially the same, and it's the same active ingredient. There's no reason a child couldn't take this if you do the calculation and make sure you give them the right amount. It's important to not underdose, because if you don't give enough of the medication, it's not going to give the child the benefit they need, and then you risk side effects. You also don't want to overdose because these are actually toxic. If you overdose on Tylenol, you actually damage your liver, and it can even lead to a need for a liver transplant. If you overdose on ibuprofen, you can actually damage your kidneys, and those are some of the more obvious of many side effects. So these are not harmless, but they are optional, and they are helpful in the right scenario. So hopefully this helps you all understand a little bit better what these medications are, what the differences are, and how we can get creative around the lack of availability.